A CNA records a resident's blood pressure as 88/56 mmHg. What should the CNA do next? A. Report it immediately to the nurse. B. Recheck it after 2 hours. C. Give the resident fluids. D. Record and continue other tasks. Answer: B. Blood pressure may vary due to several factors. The CNA should calmly recheck after a short period before escalating unless the resident shows symptoms. When taking an axillary temperature, which of the following must the CNA do for the most accurate reading? A. Leave the thermometer in for 1 minute. B. Place it near the shoulder blade. C. Ensure the armpit is dry and the thermometer touches skin. D. Ask the resident to hold it in place. Answer: A. For accurate axillary temperatures, the thermometer must be placed properly, and the arm should be held tightly against the body for a full minute or as instructed. Which of the following may indicate the onset of infection in an elderly resident? A. Slow pulse. B. Elevated temperature. C. Lower blood pressure. D. Normal respiratory rate. Answer: D. A fever, even a slight one in elderly residents, may be a sign of infection and should be reported. What is the best site to measure a pulse during CPR? A. Brachial. B. Femoral. C. Radial. D. Carotid. Answer: D. The carotid artery is closest to the heart and most reliable during emergencies. A CNA finds a resident's respiratory rate is 28. What should be the next step? A. Document and continue. B. Wait 5 minutes and retake. C. Notify the nurse immediately. D. Have the resident do deep breathing. Answer: C. A respiratory rate of 28 is above the normal range, 12 to 20, and should be reported as it may indicate distress. If a resident has a weak or irregular pulse, what should the CNA do? A. Measure for 15 seconds and multiply. B. Skip pulse and record respiration. C. Count for a full minute and inform nurse. D. Use an automatic monitor instead. Answer: C. Weak or irregular pulses must be counted manually for 1 full minute and reported to the nurse. Which vital sign must be taken before administering a blood pressure medication? A. Temperature. B. Respiratory rate. C. Oxygen saturation. D. Blood pressure. Answer: D. Blood pressure medications can cause drops in BP, so it's critical to check and confirm it's safe to administer. You observe a resident with a flushed face and temperature of 102.4 degrees Fahrenheit. What should be done? A. Offer a cold drink. B. Recheck in 10 minutes. C. Report to the nurse immediately. D. Give acetaminophen. Answer: A. A temperature over 100.4 degrees Fahrenheit is a fever and should be reported. CNAs cannot administer medications but can comfort the patient. What is the normal range for adult systolic blood pressure? A. 90 to 120 millimeters of mercury. B. 60 to 90 millimeters of mercury. C. 100 to 160 millimeters of mercury. D. 80 to 130 millimeters of mercury. Answer: A. The normal systolic range is 90 to 120 millimeters of mercury. When measuring a tympanic temperature, the probe should be A. Pointed straight up. B. Aimed toward the lower jaw. C. Aimed toward the eardrum. D. Inserted only halfway. Answer: C. The probe should be gently aimed at the eardrum for an accurate tympanic reading. Which sign indicates possible hypoxia in a patient? A. Warm skin. B. Cyanosis around lips. C. Slow pulse. D. Clear breath sounds. Answer B. Cyanosis, bluish skin, may signal low oxygen and should be reported immediately. You're taking BP but hear no sounds. What should you do? A. Inflate cuff more than 200 millimeters of mercury. B. Release air quickly and start over. C. Reposition cuff and try again. D. Switch arms immediately. Answer C. Repositioning the cuff often solves the issue. Ensure proper placement and try again. If a resident refuses to have their vital signs taken, what is the correct CNA action? A. Skip and return later. B. Document refusal and notify nurse. C. Call family. D. Take the vital signs anyway. Answer B. Residents have the right to refuse. It must be documented and reported. Which reading would be considered bradycardia? A. 58 BPM. B. 62 BPM. C. 72 BPM. D. 88 BPM. Answer A. A pulse under 60 beats per minute is considered bradycardia. A resident complains of dizziness while sitting. The CNA finds their BP is 80/50ths. What should be done? A. Help them to stand. B. Recheck in 2 hours. C. Lie them down and alert the nurse. D. Give them juice. Answer C. A BP that low could indicate hypotension. Keep the resident safe and notify the nurse immediately. Which is the most accurate method to assess core body temperature in a critically ill patient? A. Axillary. B. Tympanic. C. Oral. D. Rectal. Answer B. Tympanic temperatures measure core body heat quickly and are less invasive than rectal methods. A CNA observes Cheyne-Stokes respiration in a terminal patient. What does this indicate? A. The patient is improving. B. The patient is dehydrated. C. The patient's breathing is normal. D. The patient is near end of life. Answer A. Cheyne-Stokes is a pattern of irregular breathing often seen near the end of life. Which of the following conditions most likely causes increased respiratory rate? A. Hypoglycemia. B. Fever. C. Bradycardia. D. Hypertension. Answer D. Fever raises metabolic demand, often increasing respiratory rate. A CNA finds a resident's pulse to be 44 BPM. The first action should be to A. Record and monitor. B. Give orange juice. C. Notify the nurse. D. Take temperature. Answer C. A pulse under 60 BPM, bradycardia, should be reported, especially if below 50 BPM. Which pulse site is typically used when assessing circulation in the foot? A. Radial. B. Carotid. C. Dorsalis pedis. D. Femoral. Answer D. The dorsalis pedis artery is on the foot and helps check lower extremity circulation. Which thermometer should not be used on a patient with a history of seizures? A. Axillary. B. Rectal. C. Tympanic. D. Temporal. Answer B. Rectal temperature may trigger seizures or cause injury in seizure-prone individuals. When should vital signs be taken more frequently? A. When the patient is stable. B. After they receive food. C. When the patient is post-operative. D. During visiting hours. Answer B. Post-operative patients must be monitored closely for any vital sign changes. Which of the following indicates a medical emergency in vital signs? A. BP 118/76, temp 98.4 degrees Fahrenheit. B. Pulse 82, respiration 18. C. Temp 97.1 degrees Fahrenheit, pulse 62. D. BP 200/110, respiration 28. Answer C. Extremely high blood pressure and rapid breathing suggest a medical emergency. What is a CNA's role after observing vital signs that are out of the normal range? A. Change the patient's position. B. Wait and observe more. C. Call the nurse immediately. D. Take blood again in 5 hours. Answer A. The CNA should always notify the nurse promptly when readings are abnormal. How long should you wait before rechecking blood pressure after initial measurement? A. Immediately. B. 1 minute. C. 5 minutes. D. 10 minutes. Answer B. Waiting 1 minute helps ensure accuracy and allows blood flow to normalize. Why is it important to use the correct cuff size when taking BP? A. To impress the nurse. B. Small cuffs give low readings. C. Incorrect cuffs give inaccurate readings. D. Large cuffs measure heart rate. Answer C. Using the wrong size cuff can give falsely high or low BP readings. What is the correct action if a resident starts shivering during a temperature reading? A. Wait until shivering stops. B. Use oral thermometer instead. C. Record the reading immediately. D. Apply a cold compress. Answer A. Shivering affects temperature accuracy. Wait and retake later. What term refers to difficult or labored breathing? A. Bradypnea. B. Apnea. C. Dyspnea. D. Eupnea. Answer C. Dyspnea refers to labored or difficult breathing and should always be reported. If a CNA cannot locate a resident's radial pulse, what should be the next action? A. Guess based on observation. B. Skip the pulse measurement. C. Try a different site like carotid. D. Record as not found. Answer C. If a radial pulse is not found, try an alternate site like carotid and notify the nurse. Which of the following findings is most concerning and should be reported immediately? A. Pulse 72, respiration 20. B. BP 118/76, temp 98.6 degrees Fahrenheit. C. Pulse 104, respiration 30. D. BP 122/80, pulse 78. Answer C. Both pulse and respiration are elevated. This could indicate distress or infection.